And as far as your, the PPI therapies, I will frequently have patients ask me about the safety of being on that for like long term. I think short trials are helpful because if it does help, it allows us to say, okay, like that is what's going on. And then if it does help, does that mean we're going to, continue that therapy for, indefinitely? And is that safe?
Yeah, so big concern over kind of acid suppression over the last couple of years, and it's kind of made its way into kind of popular culture and media and stuff as well. So I very honest with patients. I'm like, listen, proton pump inhibitors are awesome drugs for what they do, right? So they really suppress kind of acid, and there's a whole population of patients that benefit from this. When we're doing something empirically trying, there's going to be the potential for some side effect, right? All drugs, every drug out there will cause some potential side effect. My initial trial is usually 1 to 2 months. And the reason I say 1 to 2 months is it really depends on the severity of the symptoms patients are having. So if they're really severe, I want to see them in a month, as opposed to kind of more general things. And I kind of space it out to about 2 months. I tell patients that we would expect something to be different by that 1 to 2 month mark. Now, everything is probably not going to be gone, but you would expect to see some result. If there is no result, then I do not think you need acid suppression, right? That's a fair trial. If there is some response, then we really kind of talk about, am I concerned about you being on this longer, or can we kind of push it a little bit? And that's really based on kind of underlying medical conditions and that sort of thing. When we talk about the side effects of proton pump inhibitors, we're really talking about the side effects of acid suppression. And we know that our bodies need acid. Acid is really good. It just needs to stay where it needs to stay, right? So as long as it stays where it's in the stomach, it helps with digestion, absorption of calcium, magnesium, B12. That's all fantastic. Now, the tricky part of all this is, what does long-term mean? Like, when is it long term? Is that like a year? Is that 2 years? We mentioned the medical records and having patients on proton pump inhibitors. People don't even know. They're like 10 years, 15 years. That's a problem. That's really a problem, because 10 to 15 years of chronic acid suppression, I mean, you can't get those patients even off of PPIs at that point. So when I talk to patients about long-term, again, I'm very upfront, being like, the literature says that there's potential for these side effects, but it does not tell us what long-term means. So I would say for you, we would talk about doing this course of treatment or this type of follow-up, with the idea being that we should try to get people off of these medications almost 100% of the time.
At what point, are we talking like, months or years, or when do you say like, okay, we need to get you off of this?
So usually what I do is, when at that 2-month follow-up with patients, we talk about it. So we actually talk about, should we try tapering you off? Because often when I first start and I'm doing an empiric trial, I'll put them on a high dose, right? Because I'm like, if we're going to do this, let's do this, right? Let's go 100% into this acid suppression for a short period to really see if there's any effect. So at the 2-month mark, I definitely want to start bringing you down. Okay. And when I mean high dose, I mean like 40 milligrams. Usually I do omeprazole. I've transitioned away from the BID twice a day and instead doing a high dose Pepcid at night to get that kind of dual coverage. So definitely at the first follow-up, we talk about coming down on the dose now. So we start tapering right off the bat. And then we talk about, we can do this slowly over a few months. A lot of patients come to me and they're like, I want to get off of the medication now. So then we go a little faster with it, with the idea being that you may need to restart it again, and then we would bring you off again. So when we talk about chronic kind of disease or illness, you talk a lot about, it's unlikely to be a one-time and then you'll never feel it again. But if you do notice again, we can restart it.
And what is your dosage for your Pepcid?
I do 40 as well.
40.
For the initial trial. Yeah. So I'm like, if we're going to do it, let's just make sure the dose is too low. I see lots of patients being put on things like 20 milligrams. That's too low. That's fine for heartburn. Mm-hmm. But if we're trying to talk about extraesophageal symptoms and we want to just do an empiric trial for short term, let's put you on a higher dose and then bring you down.